In this video, we're going to talk about emergency preparedness. Part of public health we don't often have discussions about, but very important. We realize the importance when we actually have an emergency, whether a natural disaster or a man-made disaster. So public health emergency preparedness is the capability of the public health community and the healthcare systems around the community to prevent, protect, respond to, and recover from a health emergency, regardless of who causes the health emergency. Again, it could be a natural disaster or a man-made disaster. This is particularly true, and the capability is needed when something is unpredictable. So a natural disaster, a storm, for instance, can often be predictable, but other threats are often unpredictable, such as the shooting that just occurred in Las Vegas. That was a mass casualty incident. 50 people died, 500 people were wounded, and the public health and healthcare systems in Las Vegas needed to be able to respond to those very quickly and effectively. And what it involves is this coordinated, continuous process of planning, implementing, training, and measuring. Essentially, you come up with a plan, you try it out in a fake emergency situation, you test it, you see what works, you see how well you perform, and then you make any changes that you need to in order to have to improve upon your plan in the future. There are some key elements of emergency preparedness that you need to be aware of. First is this pre-planning. It's essentially preparing for everything, whether it's an infectious disease outbreak, a really large traffic accident, a natural disaster, a man-made disaster, and then being able to coordinate that response across all involved sectors. Again, in an emergency situation, it's not just the public health community that responds. You're talking about emergency services, utility companies, government systems. It's everyone needs to respond in a planned and coordinated fashion. In order to ensure this capability exists, there's a lot of different steps that you need to have in place. So it starts with simple, kind of basic public health functioning. So understanding, making sure that there's the capability to assess risk levels and do health risk assessments, as well as performing basic epidemiology functions. It's understanding the legal climate and what powers local public health and local emergency systems have and what they don't, so essentially what they can and can't do. Identifying the roles and responsibilities of all the stakeholders involved in an emergency response, as well as engaging the public, knowing, at least having community leaders aware of what should be expected under emergency conditions. That's not all, there are more. So you need the health system is in place to take care of mass casualty incidents, so making sure that you can handle hundreds, if not potentially in really terrible situations, thousands of people who may be sick or injured. That's the mass healthcare. Ensuring that there's labs available to actually do all the tests that you need to ensure, make sure there's no environmental contaminations or infectious diseases, and then having all of the countermeasures that you're going to implement to prevent death and disease in place before you're ready to go, so you're not scrambling at the last minute to put everything in the field. And what's the two things that are often not even discussed but really important: one, not only are you engaging the community, but you're informing the public about what's going on. You're not making storms seem more deadly and more dangerous than they actually are, but you're also not underselling the dangerousness of the situation. And then making sure you have a supply chain, and a supply chain is when you have all the equipment and materials in the area that needs it most. So one of the good things that the federal government did in response to Hurricane Harvey this year was that they actually had supplies ready and waiting to go into those areas in Texas before the storm even hit. So the response could occur really quickly. The same happened in Florida for Hurricane Maria, where everything was right there, or excuse me, Hurricane Irma, where everything was right there and ready to go, and there was no wait time. There was no lag time before those things were put in place. In addition to having those capabilities, you need an expert workforce to use those capabilities to their greatest extent. These are workers and volunteers who are trained in emergency preparedness, practice in emergency preparedness, and know this stuff inside and out, so that even if you don't think they have the best qualities to be in there, they know so much about this situation and about what to do in an emergency situation that it's on autopilot. Essentially, it's not even a thought, it's just an instinct about what to do. And part of having this skilled workforce to deal with emergency preparedness is making sure you have good leadership in place. The leaders in place need to make very quick decisions that have very weighty consequences, literally life or death consequences that need to be, and these decisions need to be made within seconds of hearing about the problems. And finally, we need to be accountable. Again, part of being prepared for an emergency is testing and fixing whatever systems we are using to respond to these situations. So when we're testing, we need to have a system to measure our performance, whether that's speed, whether that's the number of people impacted, whether that's estimating how many lives could have been saved or illnesses avoided, and then figuring out how much this whole thing would cost. So not how much the training would cost, that's actually very minimal in terms of comparing it to like storm damage, for instance, but making sure the money is well spent. The money that's going into the system, making sure it's actually spent on the responses and isn't getting filtered to other public health activities.